This is All India Radio, Shillong, the Northeast News Bulletin read by Rahul Chatterjee. In the wake of COVID-19, we appeal to all listeners not to lower guard, take all precautions, and all those above 45 years of age who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these three simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. National helplines are operational for providing COVID-related information and guidance to people. The national helpline number is 011-2397-8046 and 1075. And the helpline for Meghalaya is 108 and 1070. And now, the news in detail. Rescue operations were underway yesterday to trace at least 5 migrant workers from Assam and Tripura who were trapped inside a rat-hole coal mine in East Jaintia Hills district of Meghalaya. The incident took place in Umpleng area on Sunday when water gushed in and inundated the mine after a dynamite explosion. Meanwhile, opposition leader Mukul Sangma has blamed the state government for recurrence of mine mishaps in Meghalaya. The Congress leader said that the state government has to act tough to stop illegal mining activities which would otherwise continue to take place. The Government of Meghalaya has issued a health advisory in light of the finding that a significant number of persons with COVID-19 infection were brought dead to hospital. COVID-19 patients are advised to keep track of warning signs around the 8th day to be counted after the first day of detecting symptoms. These include sudden onset of increase of fatigue or weakness, worsening or recurrence of earlier symptoms or new symptoms, increase or recurrence of fever, cough, chest pain or breathing difficulty. Patients are advised to contact their doctor or local medical officer immediately on detection of any of the signs. Meghalaya yesterday recorded 467 new COVID-19 positive cases, taking the number of active cases to 6,606. 14 more deaths were reported, taking the fatality count to 592. Meghalaya also recorded 760 more recoveries, pushing the number of recovered cases to 28,867 as per the latest report. With surge in COVID-19 cases in Meghalaya, the police department has constituted Health and Hygiene Committees in every battalion headquarter as well as in every district. Director General of Police R. Chandranathan informed that around 500 police personnel got infected and 3 casualties were reported this year. The police department has joined hands with traditional institutions including Rangbashnongs and Nakmas to spread awareness and contain the virus. Meghalaya Chief Minister Conrad yesterday inspected the ongoing construction of the approach road to the Cryogenic Oxygen Plant at Jengjal, West Garo Hills. He also handed over 2 ambulances and oxygen concentrators to the West Garo Hills District Administration for COVID management. Mr. Sangma visited the COVID War Room in Thura, which is manned by a dedicated team that handles COVID-related queries. In Assam, over 33,000 Ashas, accredited social health activists, have been rendering valuable services to the rural population in tackling the COVID-19 pandemic. Health officials said that Ashas are going on house-to-house visits to make the people aware on hygiene and social distancing. They are engaged in counseling COVID patients in home isolation. Ashas are also extending support to pregnant women during their visits to the hospitals and during deliveries. The Ashas are instrumental in the vaccination drive against COVID-19 across the state. In Manipur, the aggressive mass COVID-19 testing drive has been launched for early detection and early medication to flatten the curve. Various teams consisting of medical staff have proceeded to different locations in Imphal West District to conduct mass testing. Around 3,500 to 5,000 tests will be conducted every day for the next 15 days to identify positive cases and take necessary measures. Manipur Chief Minister N. Biren Singh has advised all the 60 MLAs to set up community isolation centers at their respective assembly constituencies for accommodating COVID-19 positive patients. And with that, we end the Northeast News Bulletin, which came to you from All India Radio, Shillong. Have a nice day.